Dear patients, I wanted to reach out to you to discuss Cardiovascular Institute of the South's response to address the novel coronavirus, also known as COVID-19. I would also like to address our capabilities to respond to this national emergency, which was declared by President Trump on March 13th. 5.5 years ago, Cardiovascular Institute of the South invested in a virtual care center in line with our mission I wrote 37 years ago to provide our patients with the highest quality of cardiovascular care available. Open 24/7, staffed by nurse practitioners, registered nurses, and licensed practical nurses, telemetry techs, and care navigators. Currently, our center already handles over 30,000 patient contacts per month, serves as a center for our award-winning telecardiology program, is fully capable for performing remote consultations via an iPhone or Android device from the comfort of your home.
What are we doing to address the needs of our patients during this pandemic? First, as essential healthcare providers, our clinics are remaining open to our patients so that our patients have access to their physician. And we are taking extra precautions to sanitize our clinics and keep them virus-free so that it is safe to come to CIS. We are screening our patients to reduce the chance of exposure to the virus in our clinics, and we are leveraging the full capabilities of our virtual care center to include conducting consultations at home. Lastly, we are working with our hospital partners in each market to determine the best way to get our patients who need to be tested. As this is a fluid situation, we encourage you to visit our website, www.cardio.com, for regular updates.
What should you be doing? If you are having any respiratory or flu-like symptoms, including difficulty in breathing, fever, cough, if you've been in direct contact with a person who was tested positive for COVID-19 or is awaiting results, or if you've traveled outside of the country or were on a cruise in the past month, please call our clinic in advance of coming in. If it is determined that you should stay home, we will consider to do your consultation via telemedicine. Wash your hands often for 20 seconds with antimicrobial soap, especially after you've been in a public place or after coughing or sneezing, or if not available, use hand sanitizer containing at least 60% alcohol. Avoid touching your eyes, nose, or mouth with unwashed hands. Clean and disinfect frequently touched surfaces on a daily basis. Please remember social distancing, which goal is to avoid contact with people who are sick and put a distance between yourself and other people. If you are over the age of 60 or if you have underlying medical conditions, you should avoid all crowds and try to maintain a minimum distance of 3 feet between other people. All people should avoid crowds of greater than 10 people to avoid contact with infected people.
What does this mean for you, our patients? Again, our offices are going to remain open during regular business hours. Individual elective cases may get postponed and will be evaluated on an individual basis. We are proud of our virtual care center as, once again, we find ourselves on the forefront of innovating how healthcare is delivered. In our mission to provide our patients with the highest quality of cardiovascular care available, we pledged ourselves to technological superiority, which is now proving essential during this time of uncertainty. If you have any questions or concerns, please feel free to contact us 24 hours a day. We're always open for you, and the person answering the phone will be a healthcare provider.